HJM 6A.
HJM 6A urges Congress to take steps to ease the primary care physician's shortage in Oregon. There is no amendment, and there is no revenue impact and no fiscal impact.
Representative Lively.
Thank you, Madam Chair, committee members. My name is John Lively. I'm from House District 12, which is the city of Springfield. I bring to you today House Joint Memorial 6. I don't have to tell any of you that there's a shortage of providers, and certainly a shortage of primary care providers in Oregon. And it's pretty extreme in the county of Lane, where I come from, where with the more people added to the rolls for insurance, we have less and less providers to do that. And unfortunately, the long-term trend is for fewer providers. And so there's multiple efforts going on to start addressing this. And unfortunately, of course, those efforts are several years down the road before they will result in more providers. But a key part of that is residency and being able to train more providers. And what we do know from residency is, I think the number is 80% of the doctors stay in practice in the community or the state in which they do the residency. And so Oregon is not unique, but we have a limited number of residencies. So what this joint memorial does, it just calls upon Congress to open up. So let me just get this. We urge Congress to remove the cap on primary care medical residency programs, to explore the creation of innovative community-based graduate medical education programs, and to implement stronger planning and oversight of the use of public funds for graduate medical education. Both important from the standpoint of the federal world, but also reinforces some of what we're trying to do in this state, because there are efforts here in this state also to make some investments in doing residency, but obviously the federal government plays the critical role. And we have been in contact with Representative DeFazio and others, and they certainly understand and appreciate it and believe anything we can do kind of jointly to express the concern about this and raise the awareness will help in their understanding. So I urge your support.
Thank you. Question? Yeah.
Well, if I may, just Madam Chair, as one of the other chief sponsors, as are Senator Cruz and Senator Cano on this bill, and I'd urge the other two members of this committee to join the party. I'm happy to go sit over there, but I would just say that for those of you who don't understand the intricacies of how we pay for graduate medical education in this country, it's Byzantine is a polite word, and arbitrary is equally accurate, and we have to change that system. We've been working hard to do that at multiple levels for a long time, and in particular, I'll give you one really clear example. There's a cap on how many residents you can have, period, at a hospital, and it has to do with how many residents you have at that hospital 3 years after starting a program. Somewhere back in the dark ages, i.e. the 1960s or 70s, St. Charles
That's not dark ages.
Okay, well, dark ages for how we did graduate medical education. Before family medicine, I think, was even a board-certified specialty, St. Charles had a residency in something. I don't even know what. It might have been internal medicine, and they had exactly one resident at the end of 3 years, and that means that St. Charles is currently capped, total, period, at one resident, which means they can't start a residency program. It's a perfect place to locate a family medicine residency or psychiatry residency, both of which are critical for this state. The Affordable Care Act opened up some reallocated some slots, but Oregon didn't get any of those slots, and for primary care, with this nation facing a huge healthcare workforce shortage, it needs to change, and we need to work on multiple mechanisms. I'm working on some other ones with Representative Lively, but this is a great bill, and I urge everybody's support.
Madam Chair, I'd say a message to Congress is good, but maybe a message to the AMA might help as well.
Oh, the AMA has been working on this for some time, Senator. I've been in Washington lobbying on this bill through the American Academy of Family Physicians and the AMA probably half a dozen times personally in the offices of most of the members of our congressional delegation. So I've been there. In fact, this year I'm missing it because I'm here. But
any other questions? Thank you, Representative.
Thank you very much.
And Dr. Robyn, is it Dreibelbis? Was that even close? Dreibelbis. Okay.
She wasn't close to that.
Yes, I was.
But she tried.
So, Madam Chair and members of the committee, I thank you very much for allowing me to speak on behalf of HJM 6. My name is Dr. Robyn Dreibelbis. I'm a family physician. many, many years in McMinnville, but now I work in large part with the College of Osteopathic Medicine of the Pacific down in Lebanon, Oregon, the Osteopathic Medical School, the other medical school in Oregon. So most of what I was going to say has already been said.
I
but
apologize.
No, not at all. But just for clarification purposes and definitions, so that members of the audience, as well as all of you, fully understand the sort of spectrum of medical education. So somebody decides that they want to be a doctor, they apply to medical school, they're accepted, and that process of medical school training is 4 years long. And at the end of that 4 years, they graduate. And they're actually called doctor. But at that point that they figure out what they want to do with the rest of their life and their career and decide to be a family physician or an internal medicine physician or a dermatologist or whatever specialty speaks to them. That process, that next level of medical education on the spectrum is called graduate medical education, often known as residency. And so it's the residency portion that we're speaking of. Now, back in 1997, which is when the Balanced Budget Act of 1997 came about, it was a federal congressional decision that at that point in time, 1997, all residency that was supported and paid for by Medicare dollars would be capped at that current level. But in roundabout 2006, using numbers from 2002, the American Association of Medical Colleges, AAMC, decided that looking forward that we were going to need more physicians to take care of the populace of the United States, with people aging into Medicare as well as physicians retiring from the process. And so they decided that they were going to sort of put a number on the table, and from 2002 levels of medical school graduates, they wanted to increase that number by 30% in the next 15 years. So we're looking at that in 2017, and actually it's this year that we're going to hit that number. And in large part, osteopathic medical schools have come to the table and been a large part of that. So medical school graduates have increased by 30% over those 2002 numbers, but that 1997 Balanced Budget Act has remained capped, which means that no more residents can be trained over those numbers. Now, I brought some numbers based on the 2015 match of, so when medical students graduate and they decide what they want to do the residency in and where they want to go, they do a match, which is basically a process where the hospital says that they want that particular resident, and the resident or the medical student says that they want to go there. That process is called the match. And that match process had in it this year over 41,000 applicants for 30,000 residency spots, which means that there is a glaring deficit of 11,000 positions that those residents or those medical students who have graduated from medical school are going to not be able to go to that next level of their medical education, which is tragic, looking at and knowing what the debt load is for these people. This is a way to say that and tell Congress that this is an important issue that needs to be solved, and it has to be solved at the federal level. And so HJM 6, though in many ways symbolic, is an important way that we can show Congress that this is not a partisan issue at all. And in fact, HJM 6 was passed unanimously on the House side, 59-0. So I think that we as a state can declare that residency training is important to the process of not only taking care of our state, but taking care of the populace of the United States.
Thank you.
Thank you.
Thank you so much. Comments? All right.
I would just to follow up on what you were saying. I would point out that HCM talks specifically about primary care.
True.
Historically, when hospitals have had open slots, they've chosen to fund programs or support programs in higher paying specialties with higher levels of reimbursement. subspecialties like otolaryngology or orthopedic surgery. We need those folks, but not as much as we need primary care doctors. And we have more students, especially now that Northwest is here and up and running at full speed, which is terrific from my perspective. We have more students who want to train in family medicine and stay in Oregon for residency than we have slots in the state to take them every year, by a long shot. And we should be able to keep every single one of those if we want to. And it's a problem, and I'm really excited about this bill.
Thank you.
May I make one last comment? That is very true. And Comp Northwest is actually graduating our first class of 100 medical students that will soon be physicians, June 5th. And we matched 100% of those to residency slots in the 2015 match. 73% chose to go into primary care. And osteopathic medicine as a profession, in large part, has tended to go into primary care as a specialty choice. And we've worked very, very closely, actually, with Congressman DeFazio's office in taking a leadership role on this issue and working to draft legislation specifically identifying primary care as the way to allocate those new residency slots.
That's great. How many of those residencies are in Oregon from Comp Northwest?
I don't know that number, but I know that many of them chose to go to the Samaritan program in Corvallis.
Okay.
We filled the internal medicine residency down there with our graduates. That's 9 position. Over half of the residents in family medicine, though it's 9 this year. 5 of them went to Comp Northwest students. For family medicine, as well as some of the other specialties. And a number of them actually chose to go into OHSU as well as Legacy in the state. So I would say if I had to put a number on it, somewhere around 30.
30 out of how many?
100.
Yeah. I'd like more to stay in Oregon, but
So would we.
it is.
We need the slots.
we need
Exactly.
Yeah,
We need the slots.
That's wonderful. Okay, with that, I'll close the public hearing on HJM 6 and open a work session on HJM 6.
Madam Chair, I move HJM 6A to the floor with a due pass recommendation.
Senator Cruz moves HJM 6 to the floor with a due pass recommendation. Is there any discussion? Is there any opposition? So ordered, and
Do we have a doctor on the committee?
yes, we have a doctor on the floor. Okay.
Honored, Madam Chair.
With that, I'll close the work session at
Good
HJM 6
question.
and go this way. Keeps carrying it. Oh, yeah, the vote count. Clerk will call the roll.
Aye.
I said, is there any opposition?
Aye.
You did.
I did.
Aye.
Aye. Motion carries.
Yeah, for the record, you asked if there was any opposition, but then you didn't announce it, so.
Yes.
It's all good.
Okay.
It's all good.
All right, so now let's officially close the
Thank you.
work session on HJM 6A and go back to House Bill 2930 that is still open. And the people that can come forward are Laura Jensen, Patty O'Sullivan, and then Christina, is it